All right, so welcome to today's webinar. It is April Fool's Day. I don't have any jokes because I think we're all living in a world where we feel like a joke has been played on us recently and we're all trying to adjust. So thank you all for joining. I'm excited for our guest today and excited to come to you guys with hopefully some more feedback and advice on important topics. As always, a couple reminders. These webinars are not intended to replace treatment or therapy. They're simply an adjunct and us giving kind of information that we feel will be helpful for others and that we hope can be disseminated across the field and maybe across the globe, because we actually get viewers from all over. So as a quick reminder, please make sure if you have any questions throughout, put your comments in the pane on the right-hand side. But otherwise, we will hop right in. So today we have Dr. Melinda Stanley joining us. Dr. Stanley is a clinical psychologist who focuses really on anxiety and depressive disorders and has a specific interest in older adults. Myself and Dr. Stanley have worked together for a long time. She was my personal mentor at the VA, and we've worked together through OCD work for forever and have some of the same colleagues and mentors that we work alongside with. And so I know her experience, her mentorship, her education is par none and exceeds most of ours. But in particular, we really wanted to bring Dr. Stanley on today to talk about anxiety in older adults. And really where this started is we did a webinar last week with Interfaith Ministries here in Houston, and we really were talking about, okay, what are the struggles? What are we seeing with faith ministries, and what are we seeing people say I need help with? You know, where are the deficits? And the biggest thing they kept saying over and over is we don't know how to support our older adults dealing with anxiety. And I immediately said, well, I know who can help us with that. And that is why we asked you to come on. You know, I think, Dr. Stanley, your experience across the board is so valuable for what we do, but in particular, your experience with older adults. And I really hope today we can spend a little bit of time really thinking through how anxiety treatment might look different and what family members, friends, or colleagues can be doing to best support anxiety in the elderly population. So thank you for joining. We're excited to have you.
Well, thank you for inviting me. I have enjoyed many years of working with you and admire greatly what you and your colleagues are doing to help this world stay a little calmer. It's wonderful to have some voices of reason and some people who are helping the community balance what they need to do with what's good for them. And you've always had kind of a gift for that. The community appreciates it, and also appreciate your specific focus today on older people, because as you know, and we've worked together and shared for many years, anxiety in older people is very common. I think one thing I like to say whenever I'm talking about this is that anxiety is more common than depression in older adults. And a lot of people, if they think about mental health issues for older people, even when there is no virus, they think about depression, but they don't think about anxiety. And anxiety is actually more common for older people, even when there is no virus. So it's something that, especially now, we need to pay attention to, because it is a significant issue that often is not recognized and isn't well treated. So it's great that we have the opportunity to share some information here.
And I wonder, you know, I'm curious if you can help us understand that a little bit, but why do you think depression is more commonly recognized in older adults if really they're dealing with anxiety at a higher level than depression?
I think because that is what is asked about. For one thing, I think if a medical provider or anybody asks an older person about a mental health problem, they're more likely to ask about depression. So if you ask someone, you hear more about that. They don't ask about anxiety. And then sometimes when older people talk about anxiety, they use different words, because some of our traditional mental health words carry a lot of stigma for older people. You talk about stigma all the time. But even the word anxiety can feel stigmatizing to an older person who thinks that means they're crazy or means they have a problem. So sometimes they will even say to us when we ask, "Are you anxious?" "Oh, no, I'm not anxious. I'm just concerned," or "I just fret," or "I just think too much." We do know that worry is the kind of anxiety that is most often reported by older people, but they often don't even use the word worry, because that sometimes feels to them like a stigmatizing word. So we don't ask about it enough. And when older adults talk about it, they often use more non-traditional words. So it doesn't register sometimes among other providers as anxiety, because they say, no, I'm not anxious. But really their concern or their fret or their think too much is using up a lot of their time and is impacting their ability to be functional in ways that we know can be worked on.
Yeah, and I know that you shared some amazing resources with us, and they're going to be up on our website at peaceofmind.com. But do you mind sharing kind of those main ones, the main words that older adults would use that we actually know may translate to anxiety? It sounds like fret and worry. What are
too much? Concern is a word that lots of people will use. I'm concerned. So then when we ask, we will say, and this is maybe helpful information for people who are taking care of older loved ones, I'm concerned about this virus. Tell me more about your concerns. How often are you concerned about it? If you're concerned about it all the time, means you're probably worrying about it all the time. If you're so concerned about it that you can't do some of the things that might be good for you, and we'll talk about some of those things, then it is a problem. So I think looking at the word concern or think too much or fret or sometimes people will say nerves. Sometimes people will say, I have nerves about that. Yeah. So I think just kind of be listening for other words that people might use to express their distress. I think it's also important to look for behaviors, because sometimes older adults, maybe particularly those with cognitive impairment, aren't even able to well use words to describe how they're feeling. So looking for increased restlessness, inability to sit still, sometimes repeating the same question over and over again, using the words, what if I get sick? What if I can't see you? What if I die from this? I think those are important things to look for too. So sometimes not just what is the person saying, but what are they doing to demonstrate that they are pretty distressed.
It's been an interesting, parallel for a lot of us. Tables have turned because we're trying to parent our parents. At least myself, it's not working well for me. So I would love the advice that you have, but it's interesting.
Oh, we all know your parents.
Yes, they won't slow down, and I'm worried, and I've done my work to be able to acknowledge what's going on, right? I am scared, I'm anxious, I'm worried. They don't necessarily know how to use or communicate that same language. And so it's interesting because I'm asking them all the time, Mom, Dad, please don't go to work. Please be more careful. I mean, my mom has a chronic lung disease, sarcoidosis. She's it's very dangerous for her right now. And same with my dad. But it's interesting because most people would see my parents continuing to reach out and pour into the community and say, wow, they're not worried at all about coronavirus. But as their child, I know my parents' way of managing their anxiety is by staying busy. And actually, I think they're so worried about it that they are scared to slow down, because if they do, they have to think about it, right? And I also know the behaviors that are happening at night. So my dad and mom are staying in separate rooms because they're both so worried they'll infect each other. My dad is like, I heard my mom, she was on the phone the other night. My dad's like, get away from me, you're within 6 feet, and like, he's so scared he's going to give her this illness. But at the same time, the way he manages his anxiety is going to work. And so from the outside, it doesn't look like they're anxious, right? And so I'm curious of how we can encourage us who have parents or anyone who has elderly parents or friends or families. How do we check in with them in a healthy way? Because no one wants to be told what to do, especially by their own children, right? And it doesn't work out well for most of us when we try that. And so how, if you're not a provider, if you're a provider, I think it's healthy to look for those words because you're checking in. But how, if you're not a provider, how do you check in and how do you get a pulse and listen for those words?
Right. So I think it is important to talk to our loved ones about it, but not increase their anxiety by checking in too much, because we want to respect their independence and let them know that we're concerned. Maybe talking to people about understanding why they're doing what they're doing, but thinking about how can they in the example that you're talking about, how can they stay busy but do it in a slightly different way that doesn't involve so much contact? Or how can they speak to each other in different ways that doesn't elevate the anxiety? So I think it is important to kind of balance the frequency of checking in and the reassurance, which we in ERP, for example, we don't want to do, but as I've heard you say on some of your other talks, we are doing some of that now because we need to balance what the facts are with what we're worried about. So I think helping our loved ones be aware of what makes sense and reminding them about what would be a reasonable way to manage things, but to help them find new ways to do the things that keep them engaged in life. My own father, for example, is in assisted living and is in a position where we can't see him right now. And he's also someone who is much older than your parents and is in a very high-risk group and living in a high-risk situation. So you want to check in with them, but you don't want to express your own worries to them too much, because as long as they're doing the best they can, then we need to help them find other ways to continue to have value in their lives.
Right.
One of the things that I hope we can talk a little bit about, but I think is also important for older people. Not that it isn't important for all of us, and I'm in the older adult group myself, the younger older adult group, but is faith, the faith-based coping that is important to a lot of people, but particularly to older people. Faith is even more important in the older adult community than in younger adults. And in the work that we've done, the work that you helped with when you were still in training, we found that by far the majority of older adults in our program, it was called the Calmer Life Program, and you're going to have some resources, I think, from that program posted on your site. It was a program where we were helping people learn to use coping skills for worry. We found that most of the people, when offered the opportunity to incorporate their religion and spirituality into those coping skills, chose to do so. So I think that's another thing we can encourage our loved ones to do if we know or suspect that they are faith-based people or value highly religion, spirituality topics, issues, that we can encourage them to hang on to that, to use those skills to help themselves stay calm. It's like recognize it's the serenity prayer, the acceptance and commitment therapy type model, where you accept what the world is right now, but you continue to live the way the things are important to you. And I think when faith is an important part of what you believe, it is also important to use that as part of your coping.
Yeah, and my big call to action that I'm encouraging people right now is, we're all sitting here saying, we're so used to when something like a hurricane happens in Houston, you go, you help, right? And that's how you feel good. You're purposeful, you're helping. And right now, we can't go anywhere. We're stuck, right? And people feel like, I want to help, I want to give back. And so my call to action for everyone my age or younger, right, my little sister's age, is teach an elderly individual over the phone how to use technology. Because I think that for us, we can stay connected, right? I've got 10 different people that want to do Zoom meetups and, Zoom discussions and Zoom check-ins or FaceTime, whatever. And the elderly are feeling really secluded right now because of that, and the faith community is really struggling because oftentimes that is the only place we feel connected. My favorite quote from Dr. Perry, for those of you who don't know, Dr. Bruce Perry's done a ton of work in child trauma and wrote The Boy Who Was Raised as a Dog, and is just an incredible speaker and advocate about children and anxiety. I asked him once, I said, if we could fix America, what would you do? And he's like, oh, really? Like, thanks, Liz. That's the question you're going to give me, but I said, no, really, if you could make one change, what would you do? And he said, I would put front porches back on every single house. And, it kind of gave me goosebumps, because what he talks about in his research is how, 20 years ago, we went from households of 10, 11, and over the years, we're now an average household of 3, with 1 in every 3 being a household of 1. And when you think about the aging population, they become more secluded and isolated as they continue in life. But a lot of them do have a community that's often faith-based or rooted in bigger groups, right? Whether it's playing cards or it's, you know, you're going to church or you're volunteering, and they can't do that right now. They've been stripped from it. And so I'm curious, in addition to us taking initiative to teaching them, right? Everyone says, I'm bored, I'm stuck at home. Well, you know what? Make that your project, because it might take you a little bit of time, but we have time to do it. We can teach them how, because I do think Zoom and connections is really important for them to be able, or FaceTime, however they can do it, but to be able to have some sort of connection with their family and friends. But how can we encourage them to stay connected to their faith communities when those have been closed down?
Well, I think that, and our friend Jan Lindsay would be very happy that you brought up this topic, because using technology as best we can is important for older people. And lots of times the community at large will say, oh, they're too old, they can't learn this. And of course they can. If they don't have the resources at home, someone has to provide those for them. So if they are at a home without a cell phone or without an internet connection, somebody is going to have to provide that for them. And that is one thing that family members can do. I do know that even in nursing homes and retirement communities and assisted living facilities, staff are offering family the opportunity to conduct Skype sessions. So that has happened in my own family and in other people that I know, where staff are setting up Skype meetings with residents and their families. I think that's an important thing that the communities are doing, and the community living settings are doing. And they could do that also with church services. So many of our church services are being broadcast. So if you have a family member in a setting where there are staff around, you could request that the staff set up an iPad. You could buy your loved one an iPad. There's Wi-Fi in most living facilities, and could set up an iPad for someone to watch their church service, or to watch a different church service on a television channel or something, for example. So I think that is a really important way for us to stay connected. And I think with older people, there is an extra step that's needed. And even for some of us younger older people who need extra training and how to do some of these things, older adults can learn new tricks. So we can teach them that, and we can work with the faith leaders of our own churches to reach out to the older people in the congregation who may not have as easy access.
Yeah, and I think, you know, this is where it's really about tapping into your local resources. You know, so in Houston, I know KSBJ has opened their prayer line, and they've got tons of volunteers manning it. And there's a lot of resources for people to feel like they're staying connected. To me, Christian radio, I love it. It helps me feel connected to a community that it could be on in the background, and we don't have to have much technology to access the radio, which is great. But we're gonna have to be creative. But the reality is that we can work together to try to give them resources that didn't previously exist, that they actually can probably continue using, so they continue to feel connected even when coronavirus is over.
Right. I would also want to say this, that I think in some of our skills that the CDC talks about, everybody talks about, is continuing to stay active with things that you enjoy, even if you, Jan might not like this, but even if you don't have an iPad, you can pick up your phone and call a friend. So somebody, in the churches can be encouraged to reach out and call the other members of the congregation who don't have as easy access, just to check in on them, and maybe to say a prayer with them, or to remind them of some kind of, we talk a lot about calming statements, some kind of statements that you can say to yourself, Bible verses or scripture readings or things. So I think there are other even lower level technology with just using a phone to stay connected to older people. So I think that's an important thing that we can do to help. And I think asking for more awareness of ways to help is an important thing that we can do for our older adults, is to ask ourselves, let me think about this person, and what are they doing, and what situation are they in, and what kinds of things might they need to learn to say to themselves? What kinds of things might they need to do if they can't go to church anymore. Maybe they need a hymnal at home. Maybe someone can deliver a hymnal to them and they can look at some of their favorite songs, or maybe someone can deliver a printed copy of the sermon that was online yesterday. So I think there are other ways too that we can help to try to keep people connected and help them coping and managing their stress.
Yeah, and be creative, right? I think that's, if anything, that's one of the things we're all learning during this time, is how do we creatively still get our needs met when we have so many restrictions we would never have expected that are just put in place, right? And we can work around them. So I'm going to jump in. We have a couple questions, but before we get to those, I at least want to kind of cover the second point, which is that, so you've talked a little bit about words to look out for and ways you may be able to signal or detect anxiety in older adults or your loved ones. The next question then is, if we see it, if we acknowledge it and we know it's there, what do they need? So, and maybe we don't even worry as much about Corona right now, but just in general, right? What would normally be some of the tools or strategies we would want to help them gain to be able to manage their anxiety?
Right. So one of the things that we created for this talk, and that might be useful on the website, is a little 4-page document that describes 3 of the favorite skills that people in our training programs have particularly liked, with some instructions about how to use them in a very brief way. And those 3 are deep breathing. It is amazing how helpful people find a breathing skill. We all say, oh, we breathe all the time. What's the big deal about breathing? But when you learn to deep breathe and breathe through your diaphragm and breathe slowly, so many of our older adults in our programs reported that that was their absolute favorite skill. Many of them who were religious or spiritual also paired the breathing with some kind of imagery, a word or a picture of nature or a cross or God or another important religious person in their life. So breathing combined with religion and spirituality was incredibly helpful for a lot of people. The second skill that we talk about is called calming thoughts. There are so many ways that our thoughts can make us even more anxious than we need to be. And I think particularly in this time and age, if you are a member of a high-risk group, having thoughts about, because I am in this group, I'm going to get this disease. If I get this disease, I'm going to die. No matter what I do, the virus will infect me. I mean, there's all kinds of thoughts that are similar to obsessive thoughts as well. But if we can help people recognize those, or we can recognize those in ourselves, we can substitute what we call calming thoughts. Some thoughts that help to balance. I'm doing the best I can to maintain my health. Just because I have some symptoms doesn't mean I have the virus. I can take this one day at a time. There are some, we have some of them listed in this handout, but people can come up with anything that's helpful for them. And then again, pairing it with religion and spirituality can be really useful for people. So God won't give me more than I can handle. He's with me all the time. God can make good things happen out of tragedy. There's a variety of thoughts that people have used that just help calm them down a little bit. So that's a second easy skill to understand and try to use. And then the third thing is not different than what's on also the CDC sites, is to stay active, to stay busy doing things that you enjoy or that you find value in. Those can't always be the same things. We've been kind of talking about that. They can't be the same things necessarily that they were before, but they can be variations of that. Your front porch strategy, even if you're living in assisted living, you can reach out the window and say hi to somebody. You can open your door and look out as long as you're staying far away from people. You can read, you can incorporate religion and spirituality and say prayers and read hymnals and sing songs and play religious music. And there are many things that people can do to stay involved. But like you've been saying, we have to be creative and flexible in figuring out how to do those things while maintaining our social distancing.
And I also think, it's also about how can we encourage that creativity for older adults, right? So as we're talking, I've just made a list of a couple older adults, including a family friend and my grandmother, who I'm going to sit down and write a handwritten card to tonight, because guess what? The Postal Service is still working, and that receipt will not only mean a lot to them, but it gives them a task to sit and respond, right? And so there's a lot of ways too. My grandmother used to love to knit, and so if kind of maybe I send her kind of some knitting projects, or supplies that she would need. And so there's ways for us to be creative to encourage them despite all this going on, although we have to be aware that most assisted livings, like the one my grandmother is in, and most, I think, if not all, none of them are doing outings anymore, right? So they may not be able to go buy those supplies or things that they used to buy to keep them busy. And so can we send them those things?
Right. And I think calling them and asking people, our loved ones, what do you miss? What are you missing about? And then helping them figure out how they can get a little bit of that back.
Absolutely. Absolutely.
And I think reassuring people, I know we don't want to regularly reassure people, but we do want to help people remember that this will end at some point. It will be over. Life will change, but it will go on. And I think those kinds of messages are also important, and keeping some sense of normalcy, like mailing and doing things, helps people balance that and see that this is still our life.
Right. Life is still moving, even though it's moving very differently.
Right.
So one of the questions that was submitted is, how do I help my mother? We lost our father about 2 years ago. Cope with older couples coming into her work and venting about losing their spouse. It really makes her upset. So really this kind of concept of when someone loses a loved one and then they're triggered with having to have discussions with other people going through the same situation, or even seeing other people whose significant other is still around. I know for my grandmother, when we lost my grandfather, she got moved into an assisted living right away. And because he was more taking care of her, and we had to have, and so for her, it was this 2 losses, right? She lost her house because she was moving into assisted living, and her husband. And she's constantly reminded of that, because a lot of the people in her assisted living are still a couple that's intact. And so how do we kind of help people, or help older adults with that frustration or anxiety?
I think there probably are a number of things you could do, but I think normalizing it is helpful, is to help the person recognize that this is natural. It's not awful, bad, terrible to have those thoughts of missing your loved one. I think it is important perhaps to have some kind of a calming statement that you can say to yourself when this happens, like, this bothers me, but that person will not be here forever. That if there's someone's coming into your, I think what you said is a facility, is to remind yourself that it's okay, but I can cope with this. This isn't going to last forever. And maybe to replace it with some positive memories of your loved one, and to think instead of focusing on what you're missing, what you enjoyed all the time. I guess that brings up another skill that might be useful in that situation, is the gratitude activity. That's in our little handout as well, but people can find that very useful, is to be mindful of the positive things in one's life. So the things, if you're missing your partner, to remember about the years that you had with that person, some of the fun things that you used to do together, and then to remember other good things in your life, so that you're not focused just on that loss, but who do you have still, and what do you have left to appreciate?
Yeah, and I think, it's really this switch to gratitude and purpose. And that was actually one of the comments that was just posted, is that we all need a sense of purpose right now. And I think even in the past, right, when we have these triggers or reminders, if we can turn them into purposeful, right, of something that, like, oh, well, my significant other used to do this, or this reminded me of them. But then also making sure, right, I do think it's important for us to acknowledge if someone is really struggling with grief, treatment works across any age spans. And I think that's important that we talk about for a second, is that sometimes I hear this all the time in OCD treatment: oh, I'm too old. I've lived with this for so long, you can't help me. And my answer is the same, is, well, actually, like, treatment, whether you're 4 or 84, is the exact same, and our outcomes are the same, right? Yeah, sure, you've lived with it for a longer period of time, but maybe you're even more ready to get rid of it then, because you want to live the rest of your life without this illness. And so treatment does work. And if someone's stuck in that grief stage, it's been a couple years and they're still really triggered, some appropriate grief therapy may also be recommended.
Right. So I'm part of another group that was putting together some resources for providers working with older adults. And one of the things that one of my colleagues, Nancy Wilson, led preparation of was a kind of a resource sheet, and we can provide that as well as when older adults decide they do need some help, or you decide your older adult loved one needs some help, where do you go to try to find someone, and how does Medicare cover it, and how do you get it? So we can make that available too.
That resource would be amazing. And I think, again, here's a task we can all take on, which is that we can call the nursing homes and facilities our loved ones are in and ask them to print that resource and have it at the front desk, because right now it'll more fall on the staff, right? But the staff probably knows the patients they have there that might really need some treatment or need additional help than what they can offer.
Right.
So another question that we had submitted just now is, I know worry is really disrupting my sleep. Do you have any suggestions around this?
Yes, I think maintaining sleep and eating and exercise and all of those things that CDC recommends are important. Sleep is sometimes one of the first behaviors. We didn't talk about that earlier, so it's a great comment. One of the first behaviors that we see a change in when we're overly anxious. I think that the breathing tool that we talked about earlier is a great one for helping to facilitate sleep. I think keeping a regular routine and all of those things that sleep experts always recommend are particularly important, is that you still get up at the same time, you still go to bed at the same time, that you don't take long naps during the day, you don't take any nap after about 3 o'clock in the afternoon. All of that needs to stay the same. And sometimes that's hard to manage when you're not going out as much. Sometimes people may be more ready to take a nap because they don't have anything else to do. So keeping your sleep awake cycle the same is important. But if you're having trouble falling asleep, or you wake up in the middle of the night worried and can't go back to sleep, the breathing tool can really be effective, because it not just physically changes your body, it also detracts your mind from your repetitive thoughts, because it makes you focus on your breathing. You're paying attention to your body as opposed to all those thoughts that are running through your head.
Yeah, it's a really powerful tool that a lot of us don't realize how powerful breathing appropriately can be, because like you said earlier, we think we're breathing fine.
Right. I think when we get anxious, it is true that we get anxious, our breathing gets more shallow, and then that can make us feel dizzy, and it can make us actually more anxious. As lots of the things that we do sometimes as a result of being anxious end up just making us more anxious. So right. I think along with sleep structure and keeping things routine, a breathing skill, and maybe even a coping skill, a coping thought can be helpful in those kinds of situations.
Yeah, I think that it's interesting, and I wonder too about sleeping, and not just older adults. We're talking about this across the board with anyone, but with older adults in particular. So when I'm at my grandmother's, the TV's always on, and she watches the Game Show Network and enjoys it, and that's great. But I worry right now about the amount of news consumption she's probably getting, right? Especially right now, if a lot of their activities are limited and they may be even sometimes eating in their rooms now instead of in the cafeteria. How important is it that we encourage that older adults limit the news consumption right now around coronavirus?
Absolutely. And that's part of all the recommendations that you've been talking about for people in general. None of us should be sitting watching too much TV or listening to too much news, because it just makes everybody kind of crazy. So I do think that's important for older adults as well. And you're right, if people are sitting and watching too much, watching more TV, because that's one of the things they like to do, encouraging them to watch fun shows or old movies that they used to like when they were younger, or something that they used to enjoy with their families, maybe an old sitcom or something, and helping them figure out how to find that on TV can be useful. It's something, but using the television as a positive tool and not a negative tool.
Absolutely. So I think we've gone through quite a few of the resources. I'm just going through some of the questions. So we've talked about most of them, and, interesting. A lot of people are saying, my children are really worried about me as well. And so, one of the things I do want us to touch on is how we can encourage older adults to manage their anxiety around their children, if that makes sense. So I know in particular, my mom is nervous about us, right? How are you guys doing? How every day, like, how's your job? And are you maintaining payroll? Are things going okay? What's it like? My sister is in the restaurant industry. They had to lay off a lot of their employees, and that causes stress to my sister. But for parents, it's an added layer, right? You feel this responsibility of yourself and your children or your grandchildren and everyone. So I'm just curious how, in general, they should manage that anxiety when they're worried about their own kids, but especially right now.
Right. I think some of the same strategies that we've been talking about can be useful around that. So the strategies are content non-specific, but we can put the appropriate content to them. So checking in with your children not too often, because I think sometimes we check in too often, sort of like we do with OCD. We check too often. Are you okay? Is everything all right? And then using some statements to remind ourselves that I just talked to them this morning. They seemed fine. I'll check in with them again tomorrow, or I'll check in with them this afternoon or this evening, whatever, to have some kind of regular schedule of checking and reminding yourselves that when I checked in with them the last time, they were okay. God is going to take care of them just like he's taking care of me. So I think using some of these behavioral and cognitive skills that we use for worry in general can also be appropriate to that content of worrying about your family, whether it be your children or your parents or your partner or whomever.
So how important is it right now for us to limit the worry we share with our parents? So for example, I remember one time somebody telling my mom, and she was quite baffled by it, but they said, when you're anxious and you're here, your adopted daughter's anxiety is going to go here. And next thing you know, we're here, right? And so one of the things we've talked a lot about is anxiety builds upon another, right? If you're really anxious because you're having to be the teacher and stay-at-home mom and you're dealing with your child and you have the news on in the background, your kid's going to be anxious too. They feel it. They feed off of it. And a lot of us actually might call our parents to vent, that might be kind of your normal routine, is calling your mom to say, oh, this is happening. Can you believe this? How much right now should we be cautious about, especially the elderly that don't feel like they can help right now? If they can't see us, they can't go to dinner with us, they can't be with us if they're in homes that have a lot of restrictions. How much should we also kind of limit? It doesn't mean we shouldn't call them at all, right? I don't want anyone to, but how much do you, the worries you put on them, right. I guess.
So I think some of what you were talking about earlier is using different formats for getting together. And so limiting the amount of time that you, just like they watch TV, you don't want to share too much information. You don't want to talk about it too much. Everybody's hearing a lot about it otherwise, but you want to stay connected. So maybe scheduling conversations where you don't talk about that you just talk about something else. You talk about your dogs, or you talk about your gardens, or you talk about the last movie, or what you're watching on TV, or some music that you listen to, or the symphony that's on the radio now on Sunday nights, or that you try to keep your conversations and your contact not so focused on the virus. Right. Because it's sort of like watching too much TV. When we get together with people and all we do is talk about the virus, it just amps up everybody's anxiety. So I think it is important to stay connected, but to stay connected around other things that are valued and important. So maybe scheduling a lunch, a Zoom lunch with your parents, or scheduling, getting some flowers from your garden and bringing it to taking your iPad out in the yard, or bringing it to them, a picture of it to them. Look what I found in my garden, or look how pretty this is, or I took this picture today. I'm going to send you this picture on text. Go look for your phone. Where's your phone? That's what I have to say to my dad. Where's your iPhone? I talk him on a landline. Where's your iPhone? Go find it. I sent you a picture. Look at it. How do I do that? Click on this. Oh, there it is. I see that. So I think keeping your relationships focused on something besides the virus allows you to check in, see how people are doing, share with them, but not spend so much time focused on the facts, the figures, the things that are making us all crazy.
Right. And then the last question that we will kind of end with today, I think we've talked about a little bit, but is really, they asked, what advice do you give people who are dealing with seniors who are not taking COVID-19 seriously at all? And I think we talked about this at the beginning when I talked about me trying to parent my parents and it wasn't really working, but it is important, like, how do we make sure they do understand the seriousness without necessarily causing undue anxiety?
Right. I think that's kind of a great question and kind of a generational question, because how do we convince the 22-year-olds who think they're invincible and are going to beaches and, you know, sharing drinks or whatever? How do we convince our older relatives or friends that this really is serious? So I think there is, again, the balance between sharing facts and figures, reminding people what they really need to be doing, take this seriously, but still live your life. So I do think it's also possible, depending on your relationship with the person. Like you said earlier, some people don't want to be told what to do. Maybe it's important to find a third party to share that information with your parents, the pastor or another friend or a physician or their physician or somebody else to share the information with them, because maybe the fact that someone isn't taking the information seriously is because they don't want you telling them what to do. And maybe, you know, same with an older adult, when it's time for them to stop driving, it's often very difficult for you as a child to tell your parent that they need to stop driving. It's easier if their physician tells them they need to stop driving. So maybe the same situation would be here too, is making sure you've shared the information, but if they're not listening to you, ask somebody else. If they're doing something really dangerous, ask someone else who they might listen to better to share that information.
Yeah, I couldn't agree more. And I think that, you know, for all of us, a third party usually is very helpful, right? Even if you're a teenager, you usually aren't going to listen if your parents tell you. If it comes from one of your friends, you may be more receptive. And so I think the takeaway messages are really, and what I want to kind of emphasize is that treatment's available at any age, and that there's tools and resources available that Dr. Stanley and her team work tirelessly to develop that are specific for the elderly. I was on the team, but I didn't do the work you did. But, you know, for older adults, I think it's important for us to understand the way we talk to children with anxiety is different than a teen, is different than a, you know, 30-year-old, and it's different than how we would speak to someone who's in their 80s or 90s. Doesn't mean treatment changes, right? Often it's still kind of CBT based. It's still a lot of cognitive restructuring and based on a lot of the similar principles, but the way we implement it is different.
The words that we use and the kinds of communications and the content, I would say, of the skills are a little bit different.
Exactly. And I think if anything, coronavirus has really taught us that, right? That in life, the skills that we used, you know, our everyday living is having to be modified. We're having to do it differently, even though we can still do a lot of our work or a lot of our tasks well. The way we do them is very different. And so be creative, really use this time to help and help them find useful tasks. You know, I think one of the things, my takeaway is really calling my grandmother to say, what could you and your friends use right now to keep you busy that you don't have anymore, right? What do you want? What would be useful to you, right? They probably aren't, they're definitely not sitting around playing cards anymore together, touching cards and sharing, and that may have been, but maybe they could sit in their rooms, but all do quilts or crafts, but independently, but feel like they're doing it together as a community. So we'll work together and we'll all be creative. But thank you. Today's talk was so helpful. I know we had a lot of viewers, lots of questions. And so more than anything, you can go to peaceofmind.com/coronavirus, and you will be able to find all the resources that Dr. Stanley's talking about today. They are amazing resources and really toolkits for dealing with or helping ones that you love that are older dealing with anxiety. Thank you so much for your time, Mindy, and I look forward to being in touch.
You.
You too.
Bye.
Bye-bye.